Welcome back at 921. A recently published study shines new light on what's going on with skin cells in people who suffer with eczema and psoriasis. Scientists found that those cells appear to have reactivated some of the processes seen in newly developing skin, and that could mean new ways to target the conditions. We're joined by Dr. Reena Mehta of the Uptown Allergy and Asthma Clinic. Good morning. How are you?
Good morning. I'm doing great. How about yourself?
Well, thank you. So let's talk about this. This is good news, right? That we're learning more about how these conditions can reactivate the skin cells?
Yeah, I mean, this is great news. So, the skin is a very important organ that we have in our body. The skin serves as a barrier against bacteria, allergens, irritants, so it's very important. And so eczema and psoriasis are two inflammatory skin conditions that often get triggered this time of year in the winter. And so if we can understand what's driving these inflammatory skin conditions to happen, then we can further figure out what treatments may actually help cure them.
For people who suffer with eczema or psoriasis, I mean, it seems like it's something that, they're constantly battling. What sort of, things are available to them now, and maybe how could this change the way that they're treated?
That's a really great question. So really, up until now, a lot of our treatment plans have been focused on treating the symptoms. And so different kinds of topical creams and ointments to really help alleviate the symptoms. But really what we haven't been able to figure out a lot of the times is what's triggering the eczema and psoriasis, what's causing it. And so this study published in Science, researchers actually looked at about 500,000 skin cells through RNA sequencing. So they were really trying to figure out what genetic cells drive the inflammation in both eczema and psoriasis. And what they found was that the two, eczema and psoriasis, both actually share a lot of the same molecular pathways. So if we can really understand the developing cells that trigger the inflammation, we can actually treat a lot of inflammatory conditions such as skin and burn patients, or even inflammatory conditions such as rheumatoid arthritis or inflammatory bowel disease. So what these researchers did was that they almost created like a skin atlas or a map of all the different kinds of cells in the skin to help other researchers in the future try to figure out what treatment modalities they can use, understanding what cells are driving the inflammation and the genetics behind it.
Wow, so I mean, it sounds like this really stretches far beyond just psoriasis and eczema. And while, there were some similarities found between these two conditions, they are certainly different, right?
Exactly. They are eczema and psoriasis, again, inflammatory skin conditions, but different. And so eczema is typically when you have red, kind of irritated skin, often has an environmental or chemical allergy trigger. And eczema is more common in infants, babies, and children, whereas psoriasis, the thought is that it's more white, flaky patches where it's more of an autoimmune trigger. And often we see psoriasis more commonly in adults than we do in kids.
So we're learning more, promise for the future. What, you were telling me in the break there that this is something that a lot of people see triggered, though, during these cold winter months. Why does it happen?
Yeah, I mean, a day like today, even if you don't have eczema or psoriasis, you probably have some dry skin. So those patients who really are prone to it may be struggling, especially at a time when we're also putting a lot of irritants on our skin, hand sanitizer, masks. And so at a time like this, when it's cold and you're also having a lot of irritant triggers, it can really be challenging. Your skin can be painful, it can burn, it can crack, it can hurt. And so really trying to understand what drives that inflammation may help treat it rather than just, putting a Band-Aid on it with topical creams.
All right, so certainly some exciting news there. Maybe, some more future treatments for folks who are suffering with that right now. Looking forward to that.
Exactly. Considering all inflammatory conditions, we're really on the right path to understanding what drives our genetics. It's really interesting.
Exciting stuff. Thank you so much. We appreciate you joining us this morning.